This will provide an introduction to the use of the standard treatment protocols for escape-motivated behavior. This is week 11, and we'll primarily focus on the protocols that have been described in the Sapanian Shock textbook. Before we look at the protocols themselves, I think one of the important things to review and to remember is the importance of trying to disable escape-based behaviors, either through extinction or some other manipulation, so that the targeted replacement behaviors will receive more or better or more frequent reinforcement than the problem behaviors. And remember, in this case, we're talking about problem behaviors that are maintained through negative reinforcement. So without adding any new stuff, it seems clear that behavior plans need to disable problem behaviors while enabling desired alternatives or replacements. So when we have escape-based behaviors, we have to find some way to prevent escape from a situation when problem behaviors occur, either through one means or another. One, for example, would be blocking escape responses. The other thing to think about is that the intermittent schedule of escape. So in natural settings, it seems clear to me that most problem behaviors don't always result in escape from an aversive situation, so they're intermittent. Intermittent schedules produce relatively high resistance to extinction. And I think that one of the things in Sapanian Shock talk about this is the notion of a trigger analysis to identify the chain of behaviors that lead to escape so that we can do something about it, like interrupting a chain of behaviors. And so for direct escape behaviors, those behaviors that without any social mediation provide for escape, it's always must consider the notion of the interruption of the chain of behaviors that leads to escape. The next issue is that it's very important, if at all possible, not to terminate an activity or task when the problem behaviors appear. If you do, then they're going to continue to appear. And again, intermittent negatively reinforced behaviors become very resistant to extinction, and extinction becomes even more difficult. So you don't want, through inadvertently occasionally allowing escape, to really mess up your interventions. There are other ways to disable problem behaviors besides extinction through the use of purposeful abolishing operations that weaken the quality of reinforcement that results from escape. When we think about escape-based behaviors, and you've done some kind of functional behavior assessment, a functional analysis, or a more indirect assessment, and you decided that the problem behaviors are negatively reinforced, it's very critical to ask the questions: why is some situation or stimulus aversive? Why is it aversive so that escape is reinforcing? So let's just think about some of the reasons for something to be aversive. If your clients have significant disabilities and prompting procedures are routinely used in instruction, it's very possible that a particular kind of prompt is in itself aversive and sets the occasion for problem behaviors which result in escape. So for example, physical kinds of prompts I have found are often aversive. And if that's the case, and you decide that that's the case, is it possible to use a different prompt? And you have to think about the kinds of prompts that are available, prompt hierarchies and so forth, and decide if it would be, or to use the same prompt in a different manner to reduce the aversiveness. If it's a task that's aversive, the question is, and this of course is one of the diagnostic criteria for Sapanian Shock, is it the length of task that makes it aversive? So are clients not misbehaving early in a task, but after a certain amount of time they begin to misbehave and it often results in escape? If that's true, is it possible to simply break up tasks into smaller amounts and ensure that each small bit of a task is reinforced, and thus to reduce the aversive nature of the task and reduce escape-based behaviors? On the other hand, is it the difficulty of the task that's aversive? It could be a skill issue, and obviously if the task is too difficult, is it at the inappropriate level, and should there be some other task being instructed that's more appropriate? In other words, can you modify the task to make it less aversive or less difficult? And oftentimes when you're working with very disabled clients, there are many possible tasks that would achieve the same outcome. So we always ought to ask ourselves, is substitution of a task that achieves the same outcome is possible, and that itself would also reduce escape-based behaviors. Another problem, especially with more disabled clients, is that a change of schedule or interruption in schedule often causes problems. And there are a number of published research studies that demonstrate this, and we've probably read a couple of these across your courses. In this case, and I'm not going to go into the procedures here, but the use of warnings 2 or 3 minutes prior to the change in schedule or the end of some procedure has often proved to make the transition less aversive. So these are antecedent events that reduce the aversiveness of a transition, and again, if that's possible, that may be something that's easier to do. With all these things, we have to consider the possibility of manipulating abolishing operations or creating abolishing operations that abolish the aversiveness of the situation and thus reduce negative reinforcement. One of the things we'll talk about later, for example, is it's a misnomer, as you know, but non-contingent reinforcement using breaks in a non-contingent fashion. Neutralizing routines. The idea that if we know that, for example, every day that a client comes to a community setting or a school that parent reports they haven't had enough sleep, if they're going to have increased misbehaviors, is it possible then that a brief nap would neutralize this problem? There have been some studies that showed that you can use a desirable activity early in the day as a way to neutralize, for example, agitation. So these are possible kinds of things, and there are some studies that reflect the use of neutralizing routines. Finally, it gets to the notion of choice. For escape-based behaviors, giving a client or a student a choice of activities has often proven to drastically reduce escape-based behaviors. The idea would be that a person would choose a task that was not as aversive and thus reduce the aversiveness of a task. And this is not always possible, but where it's possible, and of course increasing choice for more severely disabled clients is a quality of life issue, then choices can be effective. Note that choice for positively reinforced behaviors is not shown to be effective at reducing inappropriate behavior. So all these are ways that a behavior plan could not only enable by reinforcing replacement behaviors, but could disable problem behaviors. These are in your text, but I just want to review the idea of spontaneous shocks, replacement behaviors for escape-based problems. There's the alternative direct escape form. In other words, if a person can escape directly in a positive way, can you teach them that as a way to reduce escape-based problems? Tolerance training option, Sapani calls it this, but essentially is differential negative reinforcement of other behavior. Pre-MAC contingency option, which we'll talk about later, and again to adding abolishing operation procedures to reduce the aversiveness of task as part of a standard treatment protocol. For example, non-contingent escape, choice warnings, etc. Remember that all interventions are basically packages of things. So those are the kinds of replacement behaviors that go into these standard protocols. And as we have looked at the positive protocols, these standard protocols are extremely useful. They provide, I think, generally all the things that need to be attended to create a behavior plan of one sort of the other once you decided on your diagnosis and then what you might want to do. So the Sapani and Schock provides a very straightforward and linear process to picking a replacement behavior and then standardly implementing a protocol. All treatment protocols should be written to create a script so that we can follow them, and if you're a consultant, so that you can make sure that the planned interventions are being implemented with integrity. And finally, we're just going to go over the standard protocols in Sapani and Schock textbook. I think these protocols are an excellent aid in planning treatment packages for behaviors once you've diagnosed their function. And the whole purpose of this textbook by Sapani and Schock is to provide a diagnostic system that leads into a menu, if you will, of appropriate interventions. The first protocol in your readings is the pre-MAC contingency option. And that's the selection and implementation of requiring completion of a short task that results in the contingent removal of a task materials brief. In other words, a contingent break. That's the high preference activity is breaking contingent on a low preference activity. This is also offered as a supplemental aspect to the MAN training or the functional communication training contained in the text. There's a blank protocol on page 241, an example completed and discussed on page 239. Next one would be is tolerance training option, differential negative reinforcement of other behavior. Protocol on page 250 with a printed example and a discussion from a case on page 247. DNRO, differential reinforcement of other behavior, even for negative reinforced, can be with or without extinction. In this case, I strongly agree with Sapani and Schuck. It should be with extinction, and it should result in resetting the interval. One of the aspects of using this option is it requires some additional assessment to determine what the interresponse interval of the problem behaviors are, so you can set your DRO intervals appropriately. This is discussed very nicely again in the textbook. The next protocol is for an escape man. Next week, we're going to read in more detail about differential reinforcement of alternative behaviors, of which functional communication training is a research-based and proven alternative. And basically it provides for teaching a child to communicate, if you will, their needs. So to ask for a break, to ask for help. Asking for help can serve as an abolishing operation, making some tasks less aversive. Asking for help is not explicitly discussed in Sapani, but the same procedures contained in Sapani would be used to plan for that. But at any rate, functional communication training, or escape man, is a very, very widely researched, I think, and life quality kind of thing where you're teaching a person to communicate as opposed to misbehave to receive some desired outcome. Blank protocol on page 261, nice example on page 257 from a case. Just wanted to remind you of the importance of prompting and prompt fading when you're doing functional communication training. And again, the idea of extinction. Cannot allow the problem behavior to result in task termination. You need to use appropriate redirection during intervention, and more importantly, appropriate use of prompts early on in a chain of inappropriate behaviors. This, again, nicely discussed in the textbook. Two additional protocols. In the case of a socially mediated escape behavior, there's an alternative direct escape form. In other words, can you teach the child to appropriately escape from the aversive situation, if you will? This requires a trigger analysis to identify the chain of behaviors that have resulted in termination of a task or event, analyze client skills, and shape or teach a way for a client to escape without having to go through another person. This is not appropriate for all escape-based behaviors, but I encourage you strongly to look at what Sapani and Schuck have to say about this. Again, blank example on 271 with a printed example and discussion on page 267. Final standard protocol, beginning on page 272 and running through 284, is for non-contingent negative reinforcement, if you will. Again, this is non-contingent reinforcement. It's inappropriate. These are really scheduled non-contingent breaks. It's not really suitable for all aversive problems. In other words, some aversive situations are not task-oriented, rather they're stimuli-oriented, and this might not be as easy to plan for that, but it certainly is for problems with tasks that are difficult, too long, and so forth. To use schedule breaks, you must assess the average interresponse time so that you can set your initial schedules. Certainly encourage this to be used with extinction, in other words, not allowing someone to escape if they do misbehave. And there's a nice example of a case in a filled-in protocol on page 280 and the blank one on 282. As with all the other standard protocols, these must be faded, and the time to plan for fading or thinning is prior to implementation. So at any rate, this provides a very nice overview and a nice reading from the Sapani and Schuck text about standard protocols that flow from the idea of assigning problem behaviors to one or more functional diagnostic categories.